Did you know that high blood pressure is largely preventable, controllable, and in many cases reversible with the right intervention, including through diet, lifestyle changes, and medication if necessary? Welcome back to my channel where I talk about everything related to wellness. And if you're new here, you are welcome. My name is Dr. Oluwole. I'm a family physician and a lifestyle medicine physician. Today, I want to talk about high blood pressure and 12 ways to lower blood pressure naturally. High blood pressure, also known as hypertension, is commonly referred to as the silent killer because it rarely causes symptoms, yet if left untreated, can increase the risk of significant health problems such as heart attack, stroke, kidney disease, vision loss, vascular dementia, and more. Blood pressure is measured in millimeters of mercury and is given as two numbers. The systolic pressure, the top number, is the pressure in your arteries when your heart beats and pushes blood out around your body. The diastolic pressure, the bottom number, is the pressure in your arteries when your heart relaxes between beats and blood is pushed around your heart. As a general guide, normal blood pressure is considered to be between 90/60 millimeters of mercury and 120/80 millimeters of mercury. And this applies whether it's measured at home or at a pharmacy, GP surgery, or clinic. High blood pressure, on the other hand, is considered to be 135/85 millimeters of mercury or higher if your reading was taken at home, or 140/90 millimeters of mercury or higher if your reading was taken at a pharmacy, GP surgery, or clinic. It is estimated that 11.8 million adults in England had hypertension in 2017, equating to around 26.2% of the population, or approximately 1 in 4 adults. Globally, the World Health Organization estimates that 1.28 billion adults have hypertension. High blood pressure costs the National Health Service (NHS) over £2.1 billion every year, and high blood pressure was responsible for approximately 75,000 deaths in the UK in 2015. Now, let's talk about some of the ways to lower blood pressure naturally and reduce the risk of heart disease and other serious complications through simple and sustainable strategies. 1. Weight management. Blood pressure often increases as weight increases, and weight loss is one of the ways to control it. If you're overweight or obese, losing even a small amount of weight can help lower your blood pressure. In general, blood pressure might go down about 1 millimeter of mercury with each kilogram of weight loss. Also, carrying too much weight around the waist increases the risk of developing high blood pressure and its complications. In general, a healthy waist measurement should be less than 80 centimeters for all women and less than 94 centimeters for most men. A waist measurement exceeding these numbers places you from low risk to high risk and to very high risk if it exceeds 88 centimeters for women and 102 centimeters for men. These numbers may vary among ethnic groups. Ask your healthcare professional about a healthy waist size for you. 2. Regular exercise. Regular aerobic exercise can lower high blood pressure by about 5 to 8 millimeters of mercury. Experts advise aiming for at least 150 minutes of moderate intensity aerobic activity per week, which breaks down to 30 minutes daily, 5 days a week. Some examples include brisk walking, jogging, cycling, swimming, and dancing. Incorporating strength training at least 2 non-consecutive days per week can also help. High-intensity interval training is another type of exercise that can help. And in recent years, isometric exercise training has become popular as a new type of exercise training that has been shown to lower blood pressure more compared to the more traditional exercise types. But remember, any type of exercise counts and helps lower blood pressure. So choose an activity you enjoy. I would recommend though that you speak with your healthcare professional first before starting any exercise program, especially if you suffer from a chronic health condition, take prescription medications, if you're concerned about your health, or haven't exercised in a while. 3. Healthy diet. Eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products can help lower high blood pressure by up to 11 millimeters of mercury. An example of an eating plan that can help control your blood pressure is the Dietary Approaches to Stop Hypertension, also known as the DASH diet. The DASH diet recommends eating vegetables, fruits, whole grains, fat-free or low-fat dairy products, fish, poultry, beans, nuts, and seeds, and advise limiting foods that are high in saturated fats, salt, and sugar. 4. Reduce sodium or salt intake in food. Sodium has become a controversial topic recently, but the evidence is clear that even a little less salt in the diet can improve heart health and blood pressure. Sodium's effect on blood pressure varies among groups of people. In general, limit sodium to 2.3 grams a day or less, but for most adults, it's ideal to limit sodium to 1.5 grams a day or less. Doing that may lower high blood pressure by about 5 to 6 millimeters of mercury. And bear in mind that the majority of salt consumption comes from processed foods and eating out. So cooking at home as often as possible helps you have better control over your salt consumption. 5. Increase potassium intake from foods. Potassium helps balance the effects of sodium and can help relax blood vessel walls, thereby lowering blood pressure. Many fruits and vegetables are high in potassium. Examples of foods high in potassium include bananas, sweet potatoes, spinach, avocados, and beans. Ensuring you get enough potassium in your diet while cutting back on sodium is a powerful combination for managing high blood pressure. While potassium is generally considered beneficial for blood pressure, it is crucial to consult with your healthcare professional before significantly increasing your potassium intake, especially if you have kidney problems or are taking certain medications that cause you to retain potassium. 6. Eat magnesium-rich foods. Magnesium helps to relax blood vessels and helps in blood pressure control. Examples of foods rich in magnesium include leafy greens such as spinach, black beans, quinoa, chia seeds, almonds, and dark chocolate. If you're considering taking a magnesium supplement, you should consult with your healthcare professional first if you suffer from heart or kidney disease. 7. Limit alcohol consumption. Drinking too much alcohol can raise your blood pressure by many points. It can also make blood pressure medications less effective. The World Health Organization released a statement on January 4, 2023, stating that no level of alcohol consumption is safe for our health. 8. Limit caffeine consumption. While this may be considered a myth, because although caffeine can cause a temporary increase in blood pressure, it does not appear to have a long-term effect on it. However, it is sensible to minimize caffeine consumption, especially if you have uncontrolled and extremely high blood pressure. 9. quit smoking. Smoking can cause an increase in blood pressure. Stopping smoking helps lower blood pressure. It can also help lower the risk of heart disease and improve your health and overall well-being. 10. Sleep. Getting fewer than 7 hours of sleep every night for a prolonged period of time can play a role in high blood pressure. Adults should aim for 7 to 9 hours of sleep every night. For more information, you can watch my video on sleep. Schedule an appointment with your healthcare professional if you're having trouble sleeping, as they can help identify any potential underlying causes, if any, and recommend appropriate treatments. 11. Stress management. Long-term stress may play a role in high blood pressure. To combat chronic stress, you can try meditation, deep breathing exercises, spending time outdoors, engaging in hobbies you enjoy, practicing gratitude, making time for relaxation, staying away from stress triggers, and stop focusing on things you can't change. 12. Control your cholesterol and blood sugar levels. High blood sugar and high cholesterol levels can contribute to high blood pressure. Maintaining healthy cholesterol and blood sugar levels can help prevent or manage high blood pressure. To help manage cholesterol and blood sugar, try some of the same healthy habits that help lower blood pressure, like eating healthy, regular exercise, losing extra weight, not smoking, and the other interventions already mentioned. It's also important that you follow your healthcare professional's advice on how to manage cholesterol and blood sugar. Staying informed and being proactive about your health can significantly reduce the risk of high blood pressure and the complications associated with it. Monitor your blood pressure at home and schedule regular checkups with your healthcare professional to ensure that your levels remain within a healthy range. Decide with your healthcare professional how often you should monitor your blood pressure at home. By making the lifestyle changes discussed, adopting the DASH diet, and working in partnership with your healthcare professional, you can significantly lower your blood pressure and improve your overall health and well-being. Don't try to change everything all at once. Small, consistent changes over time can have a lasting impact. Whether you have high blood pressure or want to prevent it, these interventions will help you live a healthier and more vibrant life. Let me know which one thing you will implement from this video by leaving a comment below. It's also worth mentioning that in some cases, despite lifestyle and dietary changes, you may need medication to lower your blood pressure, so work with your doctor. If you have found value in this video or know of anyone with high blood pressure, please share this video with them. And don't forget to like and subscribe to my channel if you have not already done so. You can also check out my other videos on limiting beliefs and making a fresh start. Thanks for watching and see you next time.